Welcome, friends, to Total Health Channel. Thank you for being with us from time to time. Please like and share this information. It's really important to some people you know, and maybe, hopefully, it'll benefit your family as well. This is focus on health. Christ spent more time healing than preaching, and this is a first in a series that I'll be doing that will be looking at Bible information. In fact, out of 5 important topics today, number 5 is Bible, how it could have spared us a lot of trouble that we're seeing right now with people dying suddenly, etc. We'll talk about it later, and I hope what I share will not mention anything that will get this information taken down. We live in a land of free speech, supposedly, and so please consider information. I'm a physician, MD, with a public health degree, courses in nutrition, board certified internal medicine, had a fellowship in cardiology before teaching health at Loma Linda University, health science. It was a community featured in National Geographic cover story in November of 2005, excuse me. And I think my credentials that I've just given you put me far ahead of 99% of people who are out there talking about health. And I'm doing it. I'm 80 years old, better health than when I was 35 and had headaches, couldn't figure it out. But I'm living well, and I don't see anything coming for me at 80. So please take a listen. The idea is basically the body is designed for self-healing. It's not about heart disease getting us, so we need a bypass. That was outmoded decades ago. And it was this was focus here from 1990. Okay, so over 30 years ago, a third of a century, we've known actually Pritikin in the mid-70s was reversing heart disease with a low-fat, low-cholesterol diet. I went to the cardiology convention in Anaheim and heard him report how his diet got 85% off of high blood pressure drugs. Drugs are a leading cause of death. This is why I can say the number one point to share with you is medical care is not health care. Okay, it's a leading cause of death. Medical care defined is really diagnosis and treatment of disease. And the treatment is usually prescription drugs. That's how they say take this and come back in a month. You need it, etc. Well, maybe we do, maybe we don't. Probably we don't need it, okay? Because as Hippocrates, father of medicine, said many centuries ago, let your food be your nature cures, let your food be your medicine. Well, we can do that. And so let's understand this better. First of all, when I was teaching at Loma Linda, the dean came to me one day, and I appreciate him as almost a second father to me. He has shaped my life in the last over 50 years because of the training I had. I was going to be a missionary to Africa, but the thing didn't work out, and I shared with him the situation while I was taking public health. He said, well, if I were a young man, I'd like to take further training, and if you would take some internal medicine and cardiology, you could come back and teach here, train other missionaries. Well, that idea appealed to me, and I did that. I was board certified in internal medicine, and while teaching there, he came and said, you know, this was mid-70s, they're starting to call medical care health care. Like it didn't compute in his brain. He was an MD. He has a PhD degree in pharmacology from Stanford, and he knew that medical care is not health care. Health care is what we do for ourselves, healthy habits. And Dr. Breslow of UCLA did a 10-year federally funded study in Alameda County, California, which is LA, and showed that 7 simple health habits were good for about an average of 11-year difference between the people who observed them compared to people who had only 3 or less. If there's a complete all 7 observed versus all 7 broken health habits, there was about a 30-year advantage. If you smoked, drank, and were obese, those are the big 3, you didn't do well. And I'm saying this was before the days of cholesterol. His study was started before the Framingham study reported. Now if you add in cholesterol foods and so on, you can live well, and I'm doing it at 80. I have a teacher that died 2 years ago who was 104. He helped surgical residents until he was 95, okay? And I got a Christmas card a couple years ago from a teacher of mine who was 95 with a chainsaw and a tree down in the picture. Doing fine at 95. So I'll just say, you know, we can live well and not need medical care. And but the CDC is lying to us. They have never mentioned medical care in a leading cause of death in spite of medical literature reporting it. In 1998, this was tax day, April 15, 1998, the JAMA, Journal of American Medical Association, reported 106,000 deaths in hospitals from adverse drug reactions, which are defined as properly prescribed and administered. These are not a bad prescription and not a overdose. Okay, it's just that some people react badly, and you can't predict how. And I give you a personal testimony of my wife living in Maryland. She got a bladder infection, went to her doctor. He was happy to prescribe Cipro is what she took. I have prescribed it, not my favorite, but it cured her infection. She was over the hump in just 2 or 3 days and stopped the medicine. But a few months later, she had spots under her skin. She went back to her doctor, who did a blood test and called urgently the next morning, reporting that she had no platelets in her blood. She needs to see a hematologist. The hematologist said he needed to put her in the hospital. He did a bone marrow exam there. He took out her spleen because he thought maybe the spleen is overactive and taking care of the platelets that way. Well, didn't help. High steroids, gamma globulin, transfusions, in and out of hospitals till she died of a stroke, okay? Just from a antibiotic that she took 2 or 3 days. Bad situation, bad. And she was a chiropractor's daughter, didn't believe in drugs, and I don't believe in them either at this point. I went through U.S. Senate offices to see the senators until one senator said, "You're wasting your time. They own us." Speaking of donations made to their re-election campaign. How good is that? They give an oath of office to do the best for America, and they're eager for their investments and their stock in pharmaceutical companies and doing everything to help them, which is how Obamacare came. Favorite friend of mine, actually I knew him personally, Ben Carson, said Obamacare is the worst thing since slavery. Well, yes, I believe so, and people are in bondage if they have to go back and see the doctor every month or for another prescription when they could live well without it. And I'm here to share with you how we can do that. Favorite author, I'm going to read just one paragraph from a favorite book of mine. In fact, I heard a pathologist say this is the best single book ever written. Okay, well, Bible is really supposed to be the best book, but it's 66 books. If you only had one book of the Bible, this is a better one, I think, because it has some of Christ's life, has some on natural remedies, has some on the home, has some on, but it's not denominational in any way. Pure air, sunlight, abstemiousness, which means abstaining from harmful things, and moderation or balance in the other things of life. Rest, exercise, proper diet, use of water, trust in divine power. These are the true remedies, she says, and I believe it. And of all of those, it's not the air we breathe, the sunshine, or even the water we drink, as much as what we choose to put in our mouth from smoking, drinking, and obesity being major risk factors. We overdo some things that are good for us, but it's our choice. Okay, we do that to ourselves, and we can change and eliminate and reverse most disease. If you can eliminate the #1 killer by heart disease by diet and exercise, you can do the other rest of the things will happen too, except that I made the mistake of saying this is #1. Actually, the truth be known, I have medical literature to show it's medical care is now #1. When JAMA, Journal of American Medical Association, reported adverse drug reactions as the 4th to 6th leading cause of death in hospitals, 2 years later, the Western Journal reported 199,000 outside the hospital. And if you add them together, 106 and 199 is 305,000 dying from drugs properly prescribed and administered. How much sense does that make? Okay, and it's the number 3 cause of death at that point, and that's over 20 years ago. Decades that we've known this, but the CDC is a lying situation. They have never reported adverse drug reactions or medical care in their top 10 list. They're in bed with pharma, okay? Liars. And I will tell them that before the throne of God, okay? And will someday, probably, okay? And sadly, even the churches are opting for science over what the Bible would share with us. And the Bible gives clear warning if you really look for it, if you ask the questions in the right way. You know, it's like Google. If you say the right things, you can learn a lot from Google. Well, the real Google is, let me say this. In Spanish, the word for library is biblioteca. Biblioteca, Bible tech, biblioteca, okay? Bible tech. If you are a good tech with the Bible, you can get the answers. And I'm going to share them with you today. I'm making 5 bold statements in this thing on health today. Number 1, medical care is not health care. Medical care is the diagnosis and treatment of disease with drugs, basically. Number 2, drugs are a leading cause of death and illness. Okay, that I quoted the Western Journal of Medicine, published in year 2000 on June, and for every death from an adverse drug reaction, there were 140 people who saw their doctor or who went to an emergency room. Some of them were admitted to the hospital. Some were admitted to long care, nursing homes, basically. Messed up for life because of something they took from some doctor that was properly prescribed. And you couldn't sue him or sue the drug company because Supreme Court, which is not so supreme, gave them a free pass. As somebody saw Washington burning in a dream or vision, may it be so soon, because they're all corrupt, it seems like. I'm not suggesting anything. I'm just saying God says vengeance is mine, and judgment is coming, really. In my opinion, we will see it this coming year, 2023. But not going there right now, just want to give you the broad picture. And so big statements: medical care, not health care. Adverse drug reactions are a leading cause of death. Health care is healthy habits, and they are good for an average of 11 years, but sometimes as much as 30-year difference between the people who break all the rules and keep all the 7 rules. And to summarize the 7 rules, New Start is nutrition, exercise, water. START is the acronym for sunlight, temperance, air, pure air, not smoking, rest. And by the way, rest is not just sleep at night. When you hurt yourself, you rest the tissues. I hurt my knee skiing. The orthopedic surgeon put my knee in a cast. Even though I didn't have a broken bone, the cast protected me and gave it plenty of time to mend and knit. And a month later, I took the cast off. I've never had a problem with my knee since then, okay, in spite of a lot of activity. But some people re-injure and then you get a weak knee, etc. Well, these are the true remedies by my favorite author, and I'm going to put the link in the description below this video. And if you will want to get good information, click the link, go to it website, and read the chapter that I read these true remedies from, the duties of a physician, or the true physician and educator. That was her concept. Physicians should educate people. Well, sadly, doctors today are not physicians. Physicians, the word physis is nature. That's when you study physics, you're studying nature. Okay. Well, physicians should be giving things from nature, but instead they're giving pharmaceuticals, which are poisons. Okay. That's the definition of Drill's textbook of pharmacology in medicine. When I was teaching at the School of Public Health, the dean, who has his PhD from Stanford University in pharmacology, he was head of the department, he shared this statement that in the widest sense of the word, every drug is by definition a poison. Pharmacology and toxicology are one. They're the same thing. And the art of medicine is to use these poisons beneficially. Well, if your blood pressure is sky high, you're about to have a stroke, yeah, take a drug and get it down. But then eat better, okay? When I was a kid, I was salting my food one night when my dad, who was a doctor, said, "Why are you salting your food?" I said, it needs it. He said, you didn't even taste it first. And he explained to me how that if people who salt their food regularly tend to get high blood pressure when they get older. Well, I got out of that habit. I'm doing well now. I haven't used salt generally. It's in the foods and the canned things, packaged foods. They all put salt. They want you to taste it, okay, and like it. But bottom line is that we can do well by our choices of eating. And by the Pritikin showed that a high-fat diet makes the blood sticky, and when it's sticky, you need more pressure to push it around your system. So he got 85% of people on high blood pressure medicine off of their drugs on a low-fat diet and exercise, eating a plant-based diet largely, low cholesterol. Well, that's true for today. The British Medical Journal reported 73%. Excuse me, I gotta take this. Hey, I'm doing a video. Call back later. Bye. 20 minutes. Okay, sorry I had to interrupt, but British Medical Journal reported COVID healthcare workers that got it had 73% less severity on a plant-based diet. That's far better than you know what, in my opinion, because the FDA reported deaths and many other problems, Guillain-Barré syndrome, encephalitis, strokes, myocarditis, acute myocardial infarction, which is heart attack, thrombosis, blood clots. In fact, the American Heart Association reported, this is just a year ago, the journal Circulation for Cardiologists, they send this out to the cardiologists, said, we conclude that the mRNA vaccine dramatically increases inflammation on the endothelium, that's the lining of the blood vessels, and T-cell infiltration of cardiac muscle, and may result in thrombosis, which is blood clots, cardiomyopathy, and other vascular events following the event. So please, I don't want to lose my channel here because, but I just want to share the facts that the Bible could have warned us about centuries, millenniums ago. It's really 2,000 years ahead of our time, and God says He declares the end from the beginning. In the book of Beginnings, Genesis 50th chapter, Joseph asks the physicians to embalm his father. What does that tell you? It tells me that the physicians in Egypt must be losing so many cases they also do the embalming, okay? And I believe we're coming back to that now with a result of what the physicians are recommending, and the undertakers are reporting bad stuff, blood clots and so on, as a result of trouble. And pharma is really up to their ears, in my opinion, in guilt, okay, for what they're doing to us for greed, just simple greed of wanting to make profits. When I took when I was teaching at the School of Health, the dean made this comment to me one day that drug companies never do long-term studies. They don't want to know the result of their product long-term. They might be liable. Yeah, they might be. Okay, they are. Guilty as hell, basically, in my opinion. So why should we go there for the answers to symptoms that we brought on ourselves by our choices of what we eat and drink and do? You know, we can do that. And so in a world for free speech, I'm saying live well, and the Bible has the answers. I've just given you the first one of 5 points from the Bible. Joseph asked the physicians to embalm his father. Do you want to be embalmed? You know, see the doctor. And number 2, when asked about the end of the world, Christ said to study the book of Daniel. And in the very first chapter, Daniel and his friends risked their lives to opt out of government health care. The king had provided the very best foods, his meat, his wine, his dainties, and so on. And they risked life for saying no, because what's this slave from captive from Jerusalem telling me how to do it? But they said, just give us a 10-day trial and you see. And sure enough, in the end of 10 days, Daniel and his friends were healthier and looked better, and they won their point. So those are 2 texts. The third text is in Christ said there was a woman who had an issue of blood for 12 years, but spent all her money on physicians and was no better. Well, that's happening again today. People spending all their money and really not any better. Another point in John 5th chapter, there's a Pool of Bethesda. And I'm going to share the relevance of this in a minute, but it was a myth that an angel would trouble the water in that pool, and the first person into the water would get healed. So it collected a vast throng of blind, impotent, weak people loitering on the banks, just waiting for the angel to trouble the water and to get in, trampling other people in the process. But didn't work well. Well, we got our Pool of Bethesda. Okay, Maryland. Bethesda, Maryland is the home of NIH, which funds drug research. It pools the tax dollars are pooled there to decide what they're going to, which research project gets the millions for figuring out a cure. Well, they've never found any cures yet, because it's really what we do for ourselves, you know, in terms of healthy habits. And the medical textbooks say unknown etiology, even for heart disease, unknown etiology. Well, you know, it's not unknown to me. If you have smoke and drink and are obese and high cholesterol and all that, it's no mystery of why we die. Stress. So I'm just appealing. Click the link below that is from a favorite author and read the chapter on the physician and educator, and see what you think, along with any other links. I'm going to put some there that you can do and live well. I forgot to mention the fifth point from the Bible is the last book of the Bible, Revelation 18, verse 23. It's a bad translation that says sorcery deceives all nations. It may seem like sorcery or witchcraft, magic, black magic, when you can take a little pill and it cures all your ills. Okay, but it's only your symptoms that are cured, and they're only for a short time. Pretty soon you have two problems. You're toxic from the medicine, and you're going to have your original problem plus another one, a pill you're taking that's causing you a second problem. So that is deceiving the nations. They would rather have relief of this symptom than, oh, I need then to relieve that symptom, and another one to take another. Pretty soon you got a bag full of pills. The luster on life is gone, and you could die very suddenly, as my former wife did. So please like this, share it, and come back again. We're going to be covering other stuff from the Bible, really, because the Bible is the best-selling book for a profound reason. God declares the end from the beginning, and we're going to be seeing how from the book of beginnings, even, judgment is coming to America and to the world very soon, 2023. You need to hear the reasons. And if I've made any sense at all today, come back in a week. We'll hope to do it again. Thank you. God bless you. And share it.